I've had the unfortunate experience of being present at Ground Zero for 9/11. I've been through several terrorist events here in New York City, and I've been here in Staten Island for Hurricane Sandy with the police department. So I definitely had my fair share of disasters in my career. This is definitely something that I've never seen before in my experience. The closest I can compare it to is 9/11. And I remember getting there and it being such a surreal moment, like being in a movie set. You arrive in something that just can't be, it's just not real. And the same thing here, my first week here in the hospital when everything became very overwhelming and the amount of patients, the influx of patients started to come in. It really set in that you felt like you were watching something in a movie set, like this can't be real, this is not happening. You stare at your colleagues all dressed up in personal protective gear and stuff that's just not in the normal function of our daily lives. It's a very, very overwhelming experience.
I know that in Staten Island, they erected tents so people could come by to be tested, and you volunteered to help with that testing.
I love to help out, and especially in the community, because that's what our hospital does. It's there for the community. The site was tremendous, the way the Department of Health had it set up. It's very, very well organized and very well structured. And then you start to see all your colleagues gearing up again in that protective gear. And then as the cars started coming in, they pull up to you and they're looking at you. And we had one lady with her husband in the car and she just started crying. And then I look around at the people I'm working with, the nurses and the other PAs, and we're scary, we're menacing. It looks like you drove through a horror movie. They're being guided by law enforcement. They had state troopers and environmental police, or military personnel guiding them into the chutes to be tested. It has to be very unsettling. They come in to get swabbed and then they leave there and they have a waiting game basically to go home and sit and wait for the results. I could understand the fear in all of them. You see the fear in their face.
Tell me what it's been like to be in the hospital, getting a firsthand look at many of these patients, Dennis.
It's something that's a challenge to the profession at its highest level. It's something that myself nor any of my colleagues here signed up for, and I know that. You watch the influx of patients come in and you watch how sad it is to have some people come in, and you like to hope you can do the best for them, and despite all the medical efforts we do, the disease just takes them. And it puts a bit of fear into you, and nobody should be ashamed to say that. It puts a little bit of fear into everyone. Unfortunately, there's no family visitation. It's very limited. And you don't realize how lonely people are. I walked into a room the other day and an older lady was there and she just stood in the room and started telling me about her whole family because they're alone. They're alone. The nurses are overwhelmed. They're busy with a lot of patients and they need someone to speak to them. And they miss that personal contact. I know the institution here in North Wales, they have the iPads, they're trying to do FaceTime. They're doing everything they can not to lose that personal touch. Every nurse is on the phone with family once a day at least. Every physician assistant is on the phone with family once a day. We try to keep that contact so they don't sit there worrying.
On a personal level, you have 13-year-old twins and your wife, and I know you're concerned for their safety every time you come home from work.
I mean, you do your best. You try to stay regimented, and that's the key. You don't get complacent. You keep your routines. You decontaminate your clothing. You decontaminate yourself with a shower. You wash your hands and wash your hands and wash your hands again. And, anytime I'm around people or family, I have a mask on. And that's just what I do. If I wear a mask in the hospital, I can wear a mask around family. And that's you stay meticulous with those details and you reduce the risk of spread. In the police department, in the fire department, and first responders, they sign up for it. They sign up to be in the bad. They know when things go bad, it's their job to be there. In this area of work in healthcare with doctors, physician assistants, nurses, even the staff in the hospital, the cleaners, the people who clean the rooms, the people who work the desks, they didn't sign up to put their lives at risk. And this is probably the most impressive aspect for me. It is overwhelmingly impressive just to see the courage that they come into work every day. They're surrounded by a lot of sadness, a lot of grief, sometimes some joy, but a lot of death, and that's the reality of it. And they come to work standing tall, leaving their families home every day, doing double shifts, doing extra shifts, doing more than what anybody has ever expected, spending too much time in rooms because it's putting them at risk. But they won't lose that touch with their patients. And, healthcare workers are on the forefront this time, and it's a unique thing. I'm very proud to be a part of it.